Today, we are delving into a topic that touches nearly every human being on the planet, either directly or indirectly. It's a universal experience, yet it's often misunderstood, stigmatized, and hidden away. We are talking about anxiety. This isn't a surface level overview. We are going to explore anxiety from every angle: its long history, its clinical definition, the physical and mental symptoms, the powerful hormones that drive it, its surprising positive side, its debilitating negative side, its root causes, and finally, the many paths to treatment and management. Let's begin our journey.
Part 1. A History of Worry. Anxiety through the ages. Anxiety is not a modern invention. It is an ancient, hardwired part of the human condition. In ancient Greece and Rome, philosophers like Seneca wrote about anxiety as a sickness of the soul. Hippocrates described symptoms of what we'd now call an anxiety disorder. They didn't have the science, but they recognized the suffering. The psychoanalytic view. Fast forward to the late 19th and early 20th centuries. Sigmund Freud introduced the concept of anxiety, Angst, as a central force in the psyche. He differentiated between realistic anxiety, a fear of a real external danger, and neurotic anxiety, an unconscious internal conflict. While some of his theories are debated today, he brought the conversation into the realm of psychology. The behavioral revolution. In the mid-20th century, psychologists like B.F. Skinner and John Watson shifted the focus to observable behavior. They proposed that anxiety was a learned response to environmental stimuli, a conditioned fear. The biological and cognitive model. Today, we understand anxiety as a complex interplay of biology, psychology, and environment. The 1980s saw the rise of SSRIs, antidepressants, revolutionizing the biological treatment of anxiety. Simultaneously, the cognitive revolution, led by figures like Aaron Beck, showed us that our thoughts, our internal dialogue, are the key drivers of anxiety. Anxiety has always been with us, but our understanding of it has evolved dramatically. Part 2. Defining the indefinable. What is anxiety? Clinically, anxiety is the mind and body's reaction to stressful, dangerous, or unfamiliar situations. It's characterized by a feeling of apprehension, dread, or uneasiness. It's crucial to distinguish it from fear. Fear is the emotional response to a real, immediate, and identifiable threat. You see a bear, you feel fear. Anxiety is the response to a future-oriented threat, a perceived, vague, or potential danger. You're worried you might see a bear on your hike tomorrow. Anxiety, at its core, is an anticipation of future threat. Part 3. The many faces of anxiety. Examples and disorders. Anxiety isn't one single thing. It manifests in several clinical disorders. Generalized anxiety disorder, or GAD. Chronic exaggerated worry about everyday life. The worry is often disproportionate and difficult to control. Social anxiety disorder. Intense fear of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged by others. Panic disorder, characterized by sudden, repeated episodes of intense fear, panic attacks that peak within minutes. Specific phobias, an irrational and excessive fear of a specific object or situation, like heights, spiders, or flying. Agoraphobia, fear of being in situations where escape might be difficult or help unavailable, often leading to avoidance of public places. Part 4. The body and mind in distress. Symptoms. Anxiety is not all in your head. It's a full body experience. Physical symptoms. Cardiovascular. pounding or racing heart, palpitations, chest tightness. Respiratory, rapid breathing or hyperventilation, shortness of breath, feeling smothered. Neurological, dizziness, lightheadedness, headaches, tremors or shaking. Gastrointestinal, nausea, butterflies, stomach cramps, diarrhea. Muscular, muscle tension, aches, restlessness, the jitters. Other, sweating, hot flashes or chills, tingling or numbness, dry mouth, difficulty swallowing. Mental or emotional symptoms. Feelings of panic, dread, or impending doom. Persistent worry and ruminating thoughts. Difficulty concentrating, mind going blank. Irritability and agitation. Feeling tense, nervous, or on edge. A sense of being watched or detached from yourself. Derealization or depersonalization. Catastrophic thinking, always expecting the worst-case scenario. Part 5. The chemical cascade, hormones, and anxiety. These powerful symptoms are driven by a chemical cascade in your body, primarily the fight or flight response. When your brain perceives a threat, real or imagined, it triggers an alarm in a part of the brain called the amygdala. The amygdala then communicates with the hypothalamus, activating the sympathetic nervous system. This triggers the release of two key hormones from your adrenal glands. Adrenaline, epinephrine, this is the instant messenger. It causes the rapid effects, increased heart rate, sweating, rapid breathing, and a surge of energy. It prepares your body for immediate action. 2. Cortisol. This is the sustainer. It keeps your body on high alert. It increases sugars, glucose, in the bloodstream to fuel your muscles and brain, and it alters immune system responses. In a real threat, this system is life-saving, but in an anxiety disorder, this system can be triggered too easily, too frequently, or for too long, leading to the chronic symptoms we experience. Part 6. A double-edged sword. Positive versus negative anxiety. Believe it or not all anxiety is bad. Positive anxiety, eustress, this is the functional, adaptive form of anxiety. It's a survival mechanism. It motivates you. A little anxiety about a test motivates you to study. It enhances performance. Stage fright can sharpen your focus and energy for a performance. It protects you. It makes you look both ways before crossing the street. This type of anxiety is short-lived and manageable. Negative anxiety, distress, this is the dysfunctional, maladaptive form. It becomes a disorder when it's disproportionate to the actual threat, it's persistent, lasting for months, and it significantly interferes with your daily life, work, relationships, and happiness. This is the anxiety that needs attention and treatment. Part 7. The roots of the storm. Causes of anxiety disorders. There is no single cause. It's usually a perfect storm of factors. Genetics. Anxiety disorders can run in families. You can inherit a predisposition to be more high-strung. Brain chemistry. Imbalances in neurotransmitters like serotonin, dopamine, and GABA are heavily implicated. Personality. Individuals who are perfectionists, easily flustered, timid, or have low self-esteem may be more prone. Life experiences. This is a huge one. Trauma, abuse, neglect, the death of a loved one, prolonged stress, or a chaotic childhood can all plant the seeds of anxiety. Medical factors. Symptoms of other diseases, heart, lung, thyroid, or substance abuse, like alcohol, caffeine, drugs, can induce or worsen anxiety. Part 8. Finding calm, treatment, and management. The most important message of all is this: anxiety disorders are highly treatable. You do not have to suffer in silence. A multi-pronged approach is often most effective. Number 1. Psychotherapy, talk therapy. Cognitive behavioral therapy, CBT, the gold standard. It helps you identify, challenge, and reframe the distorted thought patterns that fuel your anxiety. Exposure therapy, a type of CBT that involves gradual, safe exposure to the feared object or situation to break the cycle of avoidance and fear. Number 2. Medication, SSRIs and SNRIs. Example, sertraline, escitalopram. These are first-line medications that work on serotonin levels in the brain. They are not sedatives and are taken long-term. Benzodiazepines. Example, Xanax, Valium. Fast-acting sedatives for short-term relief of acute anxiety. They carry a risk of dependence and are generally not for long-term use. Number 3. Lifestyle modifications. Number 1. Regular exercise, a powerful anti-anxiety treatment. It burns off stress hormones and releases endorphins. Number 2. Mindfulness and meditation. Trains your brain to stay in the present moment, breaking the cycle of future-oriented worry. Number 3. Sleep hygiene. Anxiety and poor sleep create a vicious cycle. Prioritizing sleep is crucial. Number 4. Diet. Reducing caffeine, alcohol, and sugar can have a dramatic impact on anxiety levels.
At last, anxiety is a complex, multifaceted, and deeply human experience. It has been our companion throughout history, a vestige of an ancient survival system that can, in its negative form, become a prison. But understanding it is the first step to disarming it. By recognizing its symptoms, understanding its biological roots, and knowing the wide array of effective treatments available, we can take away its power. If you see yourself in this description, know that you are not broken, you are not weak, you are human. And most importantly, know that there is hope, there is help, and there is a path forward to a calmer, more peaceful life. Thank you for listening.